Oh, hello. Do you have an interest in true crime? How about mental illness? And why not both? Welcome to A Psych for Sore Minds, the only YouTube channel that I'm aware of which addresses the crossroads between the two. I'm your host, Dr. Sohom. I'm a consultant forensic psychiatrist and I live and work around here in London. I assess and rehabilitate mentally disordered offenders, or what the tabloids might call the criminally insane. I also act as an expert witness, so I advise criminal courts about a range of medico-legal issues during criminal trials in the UK and in psychiatric units. My clientele typically assault, rob, stab, set fires, and rape. Some even kill. I have hundreds of fascinating cases that I've personally assessed, and I'd love to discuss them with you and to share my stories. My patients suffer from a range of symptoms of mental illness. They're often driven by paranoia, delusions of grandeur, some even hear voices. To be clear, the vast majority of psychiatric patients are not violent, and the vast majority of violent offenders do not have a serious mental illness. But when the two worlds collide, the results can be catastrophic. This YouTube series is for the layperson. It breaks down a whole range of issues related to mental health and mental illness, from outlining different symptoms and squashing them into diagnoses, to telling you about the legal criteria for psychiatric defences within criminal trials. Basically, my aim is to remove the jargon, the formality, and just the stuffiness of it all, and convert it into simple, fascinating and easily digestible chunks for you. I'm also hoping to generate discussion to help us all have an open, mature conversation, and if necessary, an uncomfortable conversation at times about mental illness. Some of my episodes are about specific diagnoses and symptoms. So for example, I've done an episode on drug-induced psychosis and another episode on delusions. And I've talked about how these mental illnesses have led to offending in specific cases that I've personally assessed. Outside of my work as a forensic psychiatrist, I also have expertise in most areas of mental health, some that are completely unrelated to violence or offending. For example, in some previous episodes of A Psych for Sore Minds, I have interviewed real people who have experiences of suffering from mental illness, and they talk us through how it affected their lives. But most importantly, they help us understand how they recovered, what type of support worked for them, what type of intervention worked for them, and equally importantly, what didn't. In addition to all of that, my channel has smaller clips called Time for a Quick Shrink. In these, I answer your real life questions about mental illness from viewers like you. I give advice for you or a loved one, and I draw on my 15 years experience of working as a psychiatric doctor. Topics that I've done in these types of videos have included what is complex post-traumatic stress disorder, and also the dangers of stopping your antipsychotic medication. So look out for my channel. There's at least one new video released every week, usually on a Tuesday evening, UK time. And some weeks we have bonus videos as well. All depends on my work commitment and my time, blah, blah, blah. So if, like me, you are morbidly fascinated with crime or interested in severe mental illness and diagnoses like schizophrenia, bipolar affective disorder, if you want to know what sometimes drives people to offend, to hurt others, and to take what is not theirs, then this channel is for you. If you are interested in the inner workings of both the mental health system and the criminal justice system, if you want to know what it's really like to work behind the doors, the big locked metal doors of secure health facilities, then this channel is for you. All my material is completely free. I'm not trying to sell you any courses or any snake oil. I just want to A, give those with severe mental illness a voice and a representation, and B, share my stories and my thoughts with you. I hope you enjoy my material. If you do, please, please, please subscribe and like. It helps me gain traction, helps me attract higher calibers of guests and better collabs, and therefore it increases the quality of the channel for you. And if you don't, then just watch something else. What's your problem? Remember, I'm always open for suggestions and ideas, so feel free to reach out on social media. I hope to catch you soon. Until then, stay thymic, homies.